So before I begin, I just want to confirm how many mics do we have and where are they spread out? We have 2. Okay, because this is going to be absolutely interactive, and this is where I need the comments from all of you. Yeah, perfect. All right. So this is, okay, not this slide, my slide. Okay, all right. So problem trainees, and the interesting part is that the room is full of trainers per se, so it will be great to know your perspectives, and it will be useful for everybody in general. And thank the Ophthalmology Foundation for considering me for this talk, and I think I'm the baby ophthalmologist in the room, so I'll be happy to take it that way. And disclaimer, all problems stated here are highly fictional, and they're absolutely not related to anybody. And no humans were harmed while creating these scenarios. You may or may not correlate with the scenario. Good for you. So this is the concept which a fellowship is built on. See one, do one, and lead one. And how I like to put it across is that your fellowship is kind of divided into 3 categories. The first year, or maybe they say the first third of your fellowship is when you are seeing one. That means you're observing. So everything that you do is about observation. Observing your seniors, observing your mentor, and observing the entire system, and building on it, right? Next is do one. This is the middle third of your fellowship where you're actually, put in the taskbar where you have to perform, and you have to make sure that you're doing it right based on whatever you have seen before. And the third part is the lead one part, where now you kind of have to lead the rest of the crowd. So these are the 3 parts of the fellowship, and I will be taking 3 scenarios from the 3 different parts of a fellowship. So the first is C1. So observation is the key in training. Observe the seniors, that's the key. And all of you who have been here who have done their fellowship or their training and now are making sure that their fellows are trained, you will agree with this part. And I know that many of you would highlight and say, please observe whatever is going on. Don't try to just fall into the system. Don't try to participate early in the system, because here we are dealing with patients. We are dealing with real situations, and it cannot be just hit and trial. But does everyone want you to observe? That's the interesting part. Because when you're doing a fellowship, everybody around you is looking at you as competition. So how do you combat a competition? Okay, so that's a part. So while you are in the phase 1, that means that you're seeing and you're observing. At the same time, there's somebody or the other who doesn't want you to observe anything. And that's the part where I would like to say, this is the phase where you realize that it's the real eyes realizing the real lies. That means that you have to make sure that you know you're the best judge of what to observe, what to learn, and what to ignore. But let's go to the case scenario. So this is the case scenario from the phase 1 of the fellowship, and that is you're just a newbie in the, say, 3rd month of your training, and you were asked by your mentor to learn a particular technique. But your senior colleague tells you to ignore such a command, as it is not yet the right time for you to be learning that technique. What would you do? Now, since the room is full of trainers, I would like you to highlight the part which you would expect from your fellows to be doing. So this is over to you all. So we have 2 mics here, and would anybody want to step up and start the conversation? Or I'll be happy to pick. Yes, Dr. Prashant.
No, I think there is a problem with the senior colleague who is saying that means there is a poor relationship between the mentor and the senior colleague itself.
Okay.
As a mentor, what I will like is that if truly I have mentored my fellow well, that fellow should imbibe the same ethos and culture that I have in my work.
That's a very good point.
If I want my youngest mentee to do or observe something, my senior mentee should support that approach.
Agreed. And I think one should keep that in mind, that when you are in a fellowship, it's your responsibility to make sure that the system goes on the same way like your mentor has designed. That agreeable. Anybody else who would like to add a comment? Dr. Helena.
Well, I was thinking on the side of the fellow, it probably, if the fellow was very keen and very focused on learning that technique, would the fellow need to learn that technique from that particular senior colleague?
There is only one.
Well, that is very, well, and probably the fellow should have to report to the mentor what was going on, right?
Right.
Well, probably that would be the key. I mean, it's not something that you would be crying out on the shoulder of the mentor, but at least reporting what was happening, probably, and that would solve, as Dr. Prashant said, probably.
Right.
Well, this doesn't mean that some feeling of some uncomfort could, because seemingly they were not in the same page, which
Right.
is not very nice for the fellow.
I agree with you. In fact, I would just like to add one point, and that is that this is a scenario which kind of happens with most of us these days. And I do agree that this was not the phase when probably when you all were getting trained, because that was more cordial scenario. But nowadays, like for example, in this situation, the trainee is stuck because the trainee cannot go to the mentor and ask for that training because that's not their zone, that's not their responsibility. And at the same time, there's no other way to learn but from the senior colleague. And that's why I put the word as senior colleague in the same, in the same phrase. Because technically that person is just a few months or, a year ahead of you, but still is a senior. So there is an authoritarian component that comes from the senior colleague, but at the same time you have to learn from them.
I think this whole scenario should be looked from the perspective of the learning center or the center who is providing fellowship has serious flaws here. Because if I am a mentor, I have the responsibility to run the show. And I have to ensure that junior or senior, all of them are learning to the best of or in the best interest.
Right.
So if the system is that the learning of the junior mentee is dependent on the senior mentee, that means mentor is irrelevant in that system.
Correct.
So that's where the organizational problem starts.
Right.
You are not a right kind of a learning organization.
Agreed. And also, I do believe that when the education gets rolled over from a senior colleague to a junior, it breaks because it's like Chinese whispers. So what has been taught originally, by the time it gets passed on for 5 generations, it's gone, it's faded, and it's probably something else. So the training has to come from the person who is in charge, and that's the mentor.
I think we are quite presumptuous. Maybe this is the right situation. Probably the mentor may not know much about the mentee, the junior mentee.
Correct.
He says you can just try a topical phaco in the next OR, but your senior colleague has seen you enough. He thinks your microsurgical skills are extremely, deficit. There's a lot of deficit. He says it's not time for you to do topical. Maybe he is cautious enough to probably warn you that don't be, So this may be actually seen in the right perspective also. So it all depends upon the situation and the kind of the person the mentee actually is going through.
Yeah. KPC always likes to see the optimistic part of it.
and probably building on that idea, asking the senior colleague, okay, what should I do to start in that pathway? What should I do first?
Correct.
Or what techniques should I learn before that can lead me to learn this specific that my mentor has advised me to do right now. So probably trying to build this relationship with the senior colleague.
Well, the answer that how we see it is that it's easier to be diplomatic than to be competitive. And in this approach, it's actually good to go to the senior colleague and put it across that, hey, you do the particular technique till you're supposed to. I'm not interfering. I'm here to learn. Teach me the system. I'm not going to do it till you're gone, but at least it should be passed on to me the way it's supposed to be. So your competition is taken care of, your a gap is taken care of, and you're absolutely able to learn. So that's one way of saying it. And then we come to the next part, and that is the do one. So what's the case scenario from do one? This is the second phase of the fellowship, and which says application of what you have learned so far. And it's a premature application, of course, but your patients need you to be confident, and so does your mentor. And that's what Dr. KP just spoke about how the communication skill and the patient communication interaction. And are you doing it right? Always questioning yourself. Like, you know, in the fellowship, you're absolutely in touch with the patients. You are out there, you're interacting with real humans, right? It's not like a simulation over there. And are you doing it right? It's performance time in front of your mentor. Everyone around you is always judging you. And it's a part which many of us go through because it's a part of training. At the same time, it's practice. So the case scenario from this phase is that you're now in your second year of training. You're asked by your mentor to operate on a case yourself under the supervision of your senior. You now are you are being watched, and your hand is being held by someone who is a few months ahead of you in training. And everyone is watching you while you're operating. What do you do? So this is a part where, again, the trainers have to put in a suggestion on how the trainee's approach should be in this particular problem.
I would say that, well, for the part of the surgery, most probably the patient knows that there are trainees, and this is they are being taken care in a teaching hospital or clinic, so they know about that, and most of the consent forms signed have that expression also there. But what I think it is, and it's building the trust, as we have been seen before, is communicating with the patient, saying, starting by introducing yourself, saying that you are a fellow, you are someone who is learning, and then from there, usually the patients enjoy that. The patients, because it's something that is towards their side, and they deposit usually they deposit very trust in those who are learning, because they study, they are very interested, they have someone to tell their stories about, that usually have more time available to hear their stories. So I think this is something that can be an icebreaker, that can completely alter the whole relationship and communication afterwards. And for the trainee, is something that also builds self-confidence. For the surgery, it's a lot of, you know, brain training, Zen feeling. But I can understand what the story presents there. But you have to take a step back and watch what you're saying, what you have learned, what you have progressed so far, and that you are in training still, and you have the best around you to help you, and that is the kind of feeling and mindset the person has to develop at that stage. Right. I would say this.
I think it's all about developing the confidence in this phase. Yeah.
Yes, sir.
So Ralika, I'll touch upon the other aspect of it. Once your mentor has observed you over a period of time, he has seen your abilities, you have observed for a significant period of time, you have assisted for a significant period of time, it is his confidence that is reflecting in the decision to ask you to operate as an independent surgeon with an assistance by somebody senior. So it is, the other aspect is of how much confidence you have imbibed. So you have to, over a period of time, have built up a certain confidence by being in that environment, by observing, by assisting. So you have to bring that confidence into play to feel good about that you've been asked. That means it shows the
trust.
confidence of the trust of the senior in you, and you should be able to repay that trust by your inner confidence. And it is a step in building up your confidence and doing it independently.
Right.
For reasons of time, we'll have to wrap up,
Yes.
Dr. Rolika.
Sure.
Okay.
So I'll just quickly go to the last case scenario, and that would be a really short one. So the lead one part, there is no textbook answer on how to lead. A lot comes from trial and error and by discussions with the experts. And expectations are higher at this stage. Responsibilities are max at this stage, and it's all about what you have learned so far and even more. So the case scenario from this session, and that would be the final one, would be you're now in the final phase of your training, and you're asked by your mentor to train your junior colleagues who are probably the same age or even older than you. They refuse to listen to you the same way because they don't see you at the same level as your mentor, of course. But the scenario doesn't change. You're responsible, and you're supposed to train, and you're supposed to lead. Your mentor's wish is your command. What would you do?
Since I have the mic, I'll start. There are two things. One is that the relationship that you have with a trainee or with a junior is all dependent on how good you have been to him in not having that competitiveness which you spoke about. I think one has to realize that teaching is the best teacher to yourself. You best organize your thoughts, you learn everything by teaching. So there is no sense of competition really. If you have any traits of a teacher, you don't ever think of competition. So in that sense, if you are a good teacher, you would not have that sense of competitiveness. You would have taught your juniors, and once they see that reflected in your attitude, you never find this kind of attitude. It's virtually rare for someone junior to be kind of arrogant with you if they feel you are genuinely good to them and genuinely helping and teaching them.
Right.
So it's a mutual relationship which you build over a period of time.
Whether they pay respect or not, it's up to the teacher. Like, we make them interest in the subject and teach them immaterial, whether they are giving enough respect or not.
Right.
Yes, that is the best way.
Thank you, Dr. Rolika. Very interesting scenarios from an educator who is in training perspective. Thank you.